How do you think identity and community shape your understanding of mental health and those in your community?
I come from Ethiopian and Eritrea background. I was born in Ethiopia, and I'll say your culture and your background influences pretty much your entire view of how mental health can work. For example, coming from a society that's more collectivist versus individual, for me, a lot of what constitutes mental health and therapy includes my community and my family, and staying engaged and working with them through my issues. That doesn't necessarily mean not to get professional help, of course, but that is a big part of just coming from a country that has that as their focus, is having community at the center of every approach. So I think it's pretty much the lens that you look at mental health through.
In the Black community, and let me say this, that no one subset or one group is a monolith. So I speak for myself, but many of the systemic challenges that we see have intersectionality amongst many communities. As our county board member, J.D. Spain, was saying, oftentimes in the Black community, we are taught that being strong is the answer to mental health, that vulnerability is a taboo, that we should keep things in the family, we shouldn't air our laundry. Also, as he mentioned, many faith communities, it is taught to the preacher or the priest or pray about it, and not having the intersectionality to dialogue and discuss that along with faith and along with faith leaders, there is strength in finding an appropriate mental health individual, that you cannot navigate a mental health crisis or behavioral crisis alone.
I identify as a first-generation Latina, so I come from a background of overcoming challenges, whether it be moving to a new country, learning a new language, going into a new field that you haven't been in before. So that has shaped me into being an advocate to the community and to the people that I work for, so they can also overcome the challenges that prevent them from seeking mental health services.
Hello. I also represent the Latino community, and I would say for me, speaking from personal experience, my understanding of mental health when I was younger made me feel almost like ashamed, or it gave me like a shaming feeling, because it's not something that we talk about. It's something that, it stays at home, or it's in your head, you just have to keep going. And from my perspective, I'm a second generational born here in the U.S., so I've gotten to see things change through generations, whereas my mom struggled through things similar to what Zulani said, but now I'm seeing a different perspective because she's showing me the way. But on the same side of that, there's still people like, for example, my father, who has that mentality still that, mental health is something that you just have to push through. So it's definitely something that's still misunderstood, but I feel like in the Latino community, it's something we're still working towards understanding.
Working at KCC, I was doing talking about mental health itself, often avoided from our Asian community because we value on endurance.
Yeah, in Asian community, our culture value highly on endurance. So parents teach the kids endure everything, and endurance is the priority. And also we value on the family reputation. So usually we just hide personal struggles and not counsel with the experts. So we focus on establishing the trust first. So we are focusing on establishing the safe space for open conversation for the community. So for a long time, KCSC managed with the transparency and build the trust in the community. That's why more and more people, I think, seek for help at KCSC.